CBD oil does come with a few health benefits, according to doctors, like helping with chronic pain and even anxiety. However, there is no research that claims it can help with treating cancer. A mother in Oregon, Christina Dixon, tried to go that route with her 13-year-old daughter and is now going to jail. And joining us on the Factor Uncensored tonight is Dr. Danish Ali with Archpoint Pain Institute. Dr. Ali, we have this mother out of Oregon, Christina Dixon, whose daughter was diagnosed with liver cancer, and instead of the chemotherapy, she decided to treat her daughter with CBD oil, and now she's sentenced to 90 days in jail. Your thoughts about this?
Yeah, Isaiah, this was a rare form of liver tumor, liver cancer that was diagnosed by multiple physicians. Apparently there's reports of over 23 physicians that had seen her case, and they had all agreed that she needed chemotherapy, which is medications that help to shrink and eliminate this tumor, as well as surgery. So it was a combination of these things that these physicians had suggested. However, this
just so
mother,
the viewer can know, her daughter was 13 years old. I think that's important for the viewer to know.
That is important. You're right. And this is a rare form that's generally found in about 5 to 10-year-old kids, and very rare, but it's very aggressive if it's not treated appropriately. And so what these physicians were recommending was treatment with medications and surgery to help remove this tumor out of her liver. And so instead, she decided to go down the route of CBD after a couple of chemotherapy sessions, and the state got involved, is my understanding, and they determined that it was not an appropriate treatment for her to just treat with the CBD. So they took over, and fortunately, I think for her, for the kid, for the child, she was able to get surgery as well as chemotherapy, and because of that, she's still alive now, Isaiah, and doing well from what the reports show.
Now, for those who are wondering, when we talk about chemotherapy, could this mother have looked at her child after a treatment, a child that may have been weakened and in pain, and said, look, I'm not going to do this. I'm going to try an alternative?
Yeah, Isaiah, the problem is the alternative that she was trying.
And I'm not saying, and here's what I'm saying, Dr. Ali, I'm not saying the alternative is the right way to go. I'm saying, could the mother have looked at her child and said, this is tough on her?
That's possible, Isaiah. We don't know the full story, and we don't know what at that time what the mother was going through. However, you know, she did get multiple opinions, multiple physicians were involved, and they were all having 23 of them, correct, yeah. So they all had the same consistent answer as to what the treatment algorithm should have consisted of. Could she have done just CBD as well as the other things that they were recommending? Possibly, and that may have been completely on board, because do we know that CBD can help with some of the pain complaints? There are studies that show that. However, there's no study that shows that CBD will cure or treat this form of cancer. Therefore,
so in this capacity that the mother was using it, a replacement for chemotherapy, even if CBD relieved the pain, it still wouldn't have helped the major problem.
That's correct. Yeah. So if it was used in conjunction with some of the suggestions that the physicians that provided, I don't think she would have been in this much trouble, if at all. But the fact that she ignored and went down this route was what the state ultimately determined was not the right course for the child, and eventually ended up stepping in, rightfully so, and did help to treat, and now she's doing well.
Do you think some in the CBD oil industry or CBD industry, I'm saying some may mislead people out there saying it can do this, it can do that, when only, in your opinion, it can do what?
Yeah, Isaiah. So, you know, CBD has gotten a lot of fame through social media, through advertising that we see. And again, let's remember that the CBD is not under the governance of the FDA, just like medications are, right? So medications undergo a rigorous training and rigorous form of making sure that they are the right treatment and they don't have side effects and they do treat what they say they treat, right? CBD is considered a dietary supplement, so it does not go under the umbrella of the FDA, therefore does not go through all that treatment and all those testing that they do, right?
Mm-hmm.
So having said that, it's very you have to be very careful as to what you use it for. There are some studies that show that it can help with pain, especially pain as it relates to arthritis. But in terms of curing some sort of cancer or curing diabetes or high blood pressure, things that have a medical strong etiology that need to be likely treated with medications and dietary modifications, those are what, CBD, I don't think treats something like that.